From Oshkosh Community Media Services, this is Community Access TV2, your community television channel.
Rethink your life, your choice. Rethink your life, your choice. Rethink.
Rethink.
Rethink your life, your choice.
Rethink your life.
Rethink
Your choice.
Rethink.
Rethink
your life, your choice.
Rethink
Rethink
your life,
your choice.
Rethink. Rethink.
Rethink
Your life, your choice. Winnebago's Healthy Living Partnership.
Hello and welcome to Rethink, Winnebago's Healthy Living Partnership. Thank you for being with us here today. My name is Lisa Brown and I am pleased to serve as the Coalition Coordinator for Rethink. The purpose of today's show is to share with you, the community and citizens of Winnebago County, what Rethink is, what does it mean, and give you a bit of an introduction to your local prevention and healthy lifestyle promotion coalition. To do that, I want to begin with our vision and our mission. Rethink Vision is a community that engages and empowers all residents to live a safe and healthy lifestyle. That's the pie in the sky vision for us all. The mission is, through effective community collaboration, we create the environment that enables healthy lifestyle choices and deters substance abuse in order to improve the quality of life for all Winnebago County residents. We are housed in the Winnebago County Health Department at our new location, 112 Otter Ave, in the old Oshkosh-Bagosh Carter's building, which is gorgeous. And we are federally funded by a SAMHSA grant and also state Wisconsin Tobacco Prevention and Control dollars. And that's what enables us to do our work. Today in our show, this is our first show, and what we're going to do is share with you a couple of highlights for the coalition to help you better understand our purpose and why we exist and how we operate. So we're going to begin with sharing some local statistics found in our Youth Risk Behavior Survey. The Youth Risk Behavior Survey was completed in 2009, 2010, and Rethink worked with the CISA 6 in all the area high schools and middle schools to get this survey conducted in a very strategic format at the same time, in the same place, using the same tool. So that gave us the data that we needed to really conduct our activities. We will also speak with a local champion in prevention today and hear what he sees in his work of prevention. We'll also take a peek at some behind the scenes work and see how a coalition works with youth in our area. And we'll also summarize with providing you, the viewer, opportunities to get involved and do a recruitment bit and get you off the couch and show you how you can get equally involved and participate. So to begin with those local trends, the Youth Risk Behavior Survey findings showed that in the past 30 days, when high schoolers were asked about their substance use across the board, alcohol to binge drinking to marijuana, cigarettes, the numbers we came up with were actually kind of enlightening and provided us some hope. The blue graph is Winnebago County and the red is Wisconsin. So just looking at alcohol specifically, Winnebago County high schoolers, 35% said in the last month they have not drank alcohol. And Wisconsin is 41%, so we're below that rate. So we're very excited about that, and that is why we are doing a strategy around the prom season with the area high schools, and on the back of the prom tickets, we are going to have social norming messages. Social norming is where we promote the positives and say, hey, look, most aren't doing this. Good job, kids. The next piece of data that we looked at as a coalition is the lifetime use of substances. This is extremely concerning to us in Winnebago County. If you'll direct your attention to the prescription drug use, Winnebago County in blue at about 25% of high schoolers saying that they admit to taking a prescription drug without a doctor's script. That means illegal drug use. That's 1 out of 4 high school students when the state average is just 20%. And in response to that, our coalition has redesigned the community and created a permanent drug take-back box at the Oshkosh Police Department with a second box to follow later this year. We also have created a Good Drugs Gone Bad toolkit and conducted many presentations in our community, creating an awareness, really an epidemic around prescription drug use and getting the word out to pharmacists, parents, realtors, veterinarians, anyone who will listen about maintaining some security around your pills. Our next statistic involves parents' perception. When high schoolers were asked, do you think your parents would view it as a little wrong or not at all wrong if you were to consume alcohol underage? About 22% said, my parents would think it's a little or not at all wrong. And we would really like to see that number be higher. That's less than a quarter who think that it's a major deal. And that is why our coalition answers that call with our third year of the Parents Who Host campaign. And we'll talk about that more going forward. But Parents Who Host is a campaign with stickers, window clings, yard signs, all sorts of lunch and learn presentations that reminds parents it is illegal to furnish and provide alcohol to minors. So we really want to be very strategic in our efforts, similar to a domino effect. Anything that we knock down that domino, we want it to specifically hit one of these data points and address this and move these numbers down. Our last major finding addresses how high school students obtain alcohol or where the point of origin is. 37% said in blue, somebody gave it to me. 26% said, well, I gave somebody money to buy it for me. So collectively there you have 63% said they got it from somebody. Either they bought it or not, but they're getting it from somebody. And the way that the coalition has responded to that is through alcohol compliance checks. Oshkosh Police Department, Winnebago County Sheriff's Office, and now Town of Menasha Police, Neenah Police, Menasha, they all are doing consistent alcohol compliance checks where they show, they take underage people into places where you can obtain liquor and see if they could successfully purchase. And if the vendor does sell them alcohol, they are in fact cited. So the alcohol compliance checks rates are going down, as well as the tobacco compliance checks, which have been done through the Wisconsin WINS for quite some time. Those compliance measures are a huge point in making sure that the vendors are being held accountable. So, like any coalition, the work just doesn't come out. We don't just receive some funding and go out doing things that we think would be fun to do. We look specifically at the data and we plan our efforts around them. Like any coalition, the work arises because of a need, and so these are our needs. And it takes a lot of people to make things happen. Mentioned already, police departments, different citizens and volunteers, and it just takes a real community to make prevention happen. We are lucky enough to be joined here today with one of those local champions in prevention. And so I'd like to announce at this time that we're joined by Winnebago's County Coroner and a close friend of Rethink's, Barry Busby. Thanks for being here, Barry.
Thank you, Lisa.
Hi.
Nice to see you.
And so, Barry, we know that as a county coroner, it's a very trying job in that it's 24/7. I know that you're on call and you're faced frequently. I mean, most of your job is dealing with families who are faced with crisis or tragedy. How do you make time for Rethink or prevention efforts?
Well, our office deals with about 350 to 400 deaths a year. And we figure that probably 100% or 25% of that number, maybe up to 100 people, die from the abuse of substance, alcohol and prescription drugs, and also just not taking care of themselves the way they should or should not have died when they die. So we'd make time. It'd take a time out of our day to get involved. I've been involved with the state level on an ACE report. It's an alcohol cultural environmental study put together by 13 people on the state level down in Madison. And it shows a lot of the ways to promote a healthier, educated, and a changing cultural environmental situation. So that's just huge in itself. I'm also right now involved on the state level in a prescription drug abuse program that's going to present the same kind of brochure down the line. So alcohol and drugs kill. We need to prevent some of those. You don't want to look into the eyes of a family member and say your son or daughter or your anybody actually that somebody just died because of where they should not have died. And if we can eliminate a couple to start with and then more down the line where these people should not die that do. So it's been exciting in the prevention world. And like I said, the hardest part of my job is the grief and the dealing with the families. And that's what we don't want to look at.
I bet. Well, thank you for doing that difficult job and for making time for Rethink. And so sometimes people think about coalitions. Oh, I don't want to go to the coalition. It's a series of meetings. Can you tell us a little bit specifically about your role and how do you work with Rethink? What are you asked upon to do?
Well, we brought some statistics to the board and said a couple of years ago that 41,000 people died on our state U.S. highways. 37 of those percent were alcohol related. At the same time, 46% of 737 fatalities in Wisconsin were alcohol related, and one of the leaders in the state. A statistic where you don't want to be a leader. And Winnebago County that same year had 9 out of 15 of them accidents, the fatal accidents revolving around drunk driving. So that's a 60%, that's almost double the national average. So we take those numbers and we look at them and we want to do things to prevent those people from dying.
Yes, thank you. Can you tell us about the group that you co-chair?
Joe Yana is co-chair with me. He's the ex-court commissioner, and he and I have started the working with the advocacy group. Want to change, educate, change, work on law ordinances to be changed again, you know, state statutes and city ordinances, influence policies for a best practice procedure.
Okay. And I know evidence has shown lately that policy change is what's very sustaining. You can go talk to kids till you're blue in the face and new kids come in and those kids leave, but when you can change a policy and that's left beyond, that it creates a new social norm or condition, don't you think?
Absolutely. We have to change the culture, the society, the thought pattern on alcohol and drugs in itself, and also with what you're bringing into the table, chips down the line. So it's huge.
Who participates on the advocacy committee? Who joins you?
Well, we have the DA and some judges, the sheriff and people from his department, police chiefs from every department, and representatives from their department. We've also got the League of Women Voters, some Tavern League people, other professionals from this area, business owners, CEOs from different organizations. We have representatives and senators come to our meetings to make sure that they're on board with necessity changes on their levels.
Excellent. Can you tell us what you've accomplished so far? What has that group done?
This last year we've changed the policy on K2. It's a synthetic marijuana that was distributed through vendors on the street. We got it eliminated from Winnebago County, and it was causing sickness and some serious side effects.
It kind of came through like a buzz. Everyone was talking about K2. Have you heard about this? Do you spray it? Is it a powder? I spoke to people, my neighbors, who were saying, oh, my kids were caught doing things, but it was only incense. And so it really came through town like a kind of a buzz.
Yeah, it was fast coming in, and it wasn't governed by law. In the fact that they didn't have it on the books like marijuana and cocaine and heroin and stuff. It is now becoming, and it is outlawed in many areas. So
I would think because of the advocacy committee's quick response, I know the police chiefs were huge allies with that, and they got that done fairly quick.
Fast. It was real fast.
What else are you working on?
Well, we worked on the social host. Social host was basically to keep parents from providing alcohol, a place for their children to go, either a hotel room, a home. Take the keys away from the kids. Let them have a party, but don't let them drive away.
And is that still the rite of passage that people think to
No, it's unlawful to supply other than your own children alcohol.
It is.
It is just absolutely not the right thing to do and a wrong message to send kids, that it's okay to drink, even under controlled situations. You're creating hazardous situations and probably a lifestyle that might not be what they really want to do later down the line.
Well, it sounds like you have a heavy-hitting group of community leaders. You have some successes behind you. I know from the headlines, the 24/7 sobriety program that you're researching, the Sober Server program that you and the Tavern League are working together on. It's important. It's on the headlines almost all the time about OWIs and our concerns with that. So while sometimes we have some unlikely partnerships there with the Tavern League and the judges, it's Rethink seems to be the catalyst, or the table, if you will, that's bringing everyone up, pulling up a chair and saying, let's talk about this, let's hear your side of it.
Let's cooperate, let's coordinate and work together to get the best for Winnebago County and the state of Wisconsin. Let's eliminate some of those deaths, and let's all do our part.
Well, we've talked a little bit about your advocacy efforts. We've talked about different Rethink programs and services. Why do you think that matters to our viewers today? Why should they care about Rethink?
when you look at 100 deaths, potentially upwards, maybe even higher, but up towards 100 deaths, that affects a lot of people. There's not too many families that aren't somewhere, either know somebody or been involved in it. Either a death because of an